Is a wet and smelly belly button a sign of an infection?
Hey there! Welcome to today's video where we'll be discussing whether a wet and smelly belly button is a sign of an infection. Belly buttons are fascinating parts of our bodies, and sometimes they can experience certain issues that may cause concern. So, let's dive right into it.
Understanding the belly button.
Before we explore the possibility of an infection, let's take a moment to understand the belly button itself. The belly button, or umbilicus, is a scar-like structure that remains after the umbilical cord is detached at birth. It is a small indentation located in the center of the abdomen.
Common causes of a wet and smelly belly button.
Now, let's address the concern at hand. Is a wet and smelly belly button always a sign of an infection? Not necessarily. There can be several non-infectious causes that may lead to these symptoms. Poor hygiene. One of the most common reasons for a wet and smelly belly button is inadequate hygiene. When the belly button is not cleaned regularly and thoroughly, sweat, dead skin cells, and dirt can accumulate, leading to a moist and unpleasant odor. Sweat and moisture. The belly button is a warm and moist area, which creates an ideal environment for sweat and moisture to collect. Excessive sweating or wearing tight clothing that doesn't allow for proper ventilation can contribute to a damp belly button. Prolonged moisture exposure. If the belly button remains wet for an extended period, such as after swimming, showering, or engaging in activities that involve excessive moisture exposure, it can result in a temporary wetness and an odor. Umbilical piercings. For individuals with umbilical piercings, improper cleaning or an infection at the piercing site can cause a foul smell and discharge.
Signs of an infection.
While not all cases of a wet and smelly belly button indicate an infection, it's essential to be aware of the signs that suggest an infection may be present: persistent pain, redness, or swelling around the belly button, discharge that is thick, yellow, green, or foul-smelling, fever or chills, increased tenderness or sensitivity in the belly button area. If you experience these symptoms, it is advisable to consult a healthcare professional for an accurate diagnosis and appropriate treatment. To sum it up, a wet and smelly belly button is not always a sign of an infection. Poor hygiene, excessive sweating, prolonged moisture exposure, or complications with umbilical piercings can all contribute to these symptoms. However, if you notice persistent pain, redness, swelling, abnormal discharge, or other signs of infection, it's important to seek medical advice. Remember to practice good hygiene by gently cleaning your belly button with mild soap and water regularly. Stay healthy, take care of yourself, and I'll see you in the next video.